Hi, I'm Dr. Prem Charles, Medical Director and Specialist Orthopedic Surgeon at Life Medical Center at Dubai Silicon Oasis and Alkisais. Today, my highly specialized physiotherapists are going to teach and demonstrate some of the most important back strengthening exercise, which is very beneficial for most of the UAE population and all around the world when people are in a sedentary lifestyle. We'll be following up with more videos in the future, and I'm sure it will benefit you all.
Hi, myself Sadiq, specialist physiotherapist from Life Medical Center, and with me.
Thank you. Hello, this is Gloria. I'm physiotherapist at Life Medical Center. Today we are going to talk a few things about back pain, back exercises, what are the postures you have to adopt, and what are the postures you have to avoid if you have a back pain.
Gloria, are you aware that back pain is a symptom rather than a disease?
Yes.
Yes. What does this mean? There are many reasons for a back pain. Okay, it can be mechanical, it can be disc prolapse, it can be muscle tightness, and so on. So, it is always necessary to consult a primary orthopedician before you're doing any kind of exercise. Am I right?
Yes, exactly. So now we'll be demonstrating few of the back pain exercises. You can do this exercise at home, no problem. But as Sadiq said earlier, always consult an orthopedician before you do any of these exercises, okay? Okay, Sadiq, shall we start?
Yes.
You can lie down. Keep your legs straight. See, there are 13 things to be followed when you're doing a back exercise. The first thing would be, whenever we are performing back exercise, always make sure you're lying on a yoga mat and doing your exercise and not on the bed. You should never do exercises on your bed. The second thing would be, whenever you're performing an exercise, always make sure you're taking normal breaths, like in, out. Never hold your breath, because if you hold your breath, it can cause indigestion also. The third thing would be, either do the exercises on an empty stomach, or else you can have your meal, wait for 1 hour and then do your exercises. Okay. So we'll move on to the first exercise. The first one will be called pelvic rotation, which is you have to bend both your knees. Bend, Sadiq?
Like this.
Yes, okay. Bend both your knees and rotate your leg to one side, simultaneously looking towards the opposite side. You can look there. Okay, hold this position for 10 seconds. Back to your normal position. Okay. Same way, you have to move your trunk to the opposite side and look towards your right side. Okay. Relax. Extend your legs. So this is the first exercise called pelvic rotation. Each side you have to do for 10 seconds and repeat it for 10 times. This is the first one. The second exercise is called knee to chest. For that, bend both your knees. Bend and then bring it to your chest.
Should I hold it?
Yes, very good. You have to hold your knees to your chest. Very good. And in this exercise, make sure you're doing normal breathing. Never hold your breath. Relax. Okay? Normal. So this would be the second exercise. The third one is called pelvic bridging. Same position for your legs. Bend both the knees. Okay. And now you have to lift your hip. Lift your hip.
Like this?
Yes. Very good.
Should I use a finger for this?
No, never use a pillow when you're performing back exercise. That's very important. Hold it for 10 seconds.
They should be straight, like.
Yes. Extend. This is also for 10 seconds and repeat it for 10 times. Okay? So the next exercise is called nerve flossing. Can we do it?
Yes.
So for that, you will bend one leg, bend it, interlock both your hands behind your knee and then extend your leg. Okay? Yes. Hold it for 10 seconds and then bring your knees down. Okay? And back to the normal position. The next exercise is called prone on elbow, which requires you to do the exercise on your tummy. You can lie on your tummy.
Sure. Should I tell it?
Yes. Lie on your tummy. Then you have to place both your hands near your sides and then lift your trunk. Okay? Now you have to hold this position for 10 seconds, then back to your normal position. The next exercise is called prone on hands. It is similar to the previous exercise where you will lie on your tummy and then keep both of your hands near your sides and then lift your trunk so that you are bearing your weight on both of your hands only, not your elbows on your hands. Look up. Now hold this position for 10 seconds.
Okay.
Back to the normal position. So these are the basic exercises for back pain, and make sure you're doing all these exercises in the correct manner. and you make sure you're following all the instructions. And we hope this video has been very helpful to you guys. Thank you. We'll meet you in the next video. Thank you.
Bye.